Your patient just got intubated. Now what? We're going to talk about some post-management tips for your patients that just got intubated. First is you're going to want to order a chest x-ray. Maybe your provider orders this, maybe you put it in under the provider, but a chest x-ray is the gold standard for confirming ET tube placement. Of course, we can get sort of an initial confirmation of ET tube placement by auscultating and using a CO2 detector, but to confirm that the ET tube's in the correct location, we're going to get a chest x-ray. After most intubations, providers typically want you to place an OG tube to help decompress the stomach. When we're manually bagging someone with a bag valve mask, air goes into the lungs, but it also can go down into the stomach. A lot of times we want to place an OG tube really quick and hook it up to intermittent suction to help get some of that air out, or if they have any extra stuff that's in their stomach that puts them at risk for aspirating, it'll suck that up as well. A little pro tip, I try to place this before the x-ray person gets there. So that way on the chest x-ray, a lot of times you can confirm that, hey, that OG tube is actually down in the patient's stomach. And if you can't fully see it, you can always ask the provider if they want a KUB to confirm that the OG tube's in the stomach, and then you can use it for medications, of course, if the provider's okay with that. Next thing you're gonna wanna do is start sedation if the patient needs it. Especially if your patient got a paralytic, most likely your sedatives that you gave are probably gonna wear off prior to the paralytic, and the last thing you want is to have your paralyzed patient that just got intubated wake up. If this happens, you're going to see your heart rate's going to shoot up, the blood pressure's super high, and you're going to be like, well, what's going on? This patient's completely still. They're not moving. They're not overbreathing the vent, but their vital signs are terrible. Most likely, they're probably awake, but paralyzed. I always like to ask the provider ahead of time, like, hey, what sedation are you going to want for this patient? That way we can have it ready to go. And once your patient is intubated, you can start them on a little dose. Also wanted to continue to monitor your patient's hemodynamics and vital signs. As we've talked about, most of the time after a patient's intubated, their blood pressure tanks. And so you may need to be fluid resuscitating your patient, or maybe the provider wanted a pressor instead. After the patient is intubated, we also typically get an ABG to confirm that the settings that we have the patient on are ideal for the patient, or maybe we can adjust some things depending on what that ABG looks like. Most providers will want an ABG about 30 minutes to 1 hour after the intubation. Some other things to consider post-intubation is your patient at high risk for pulling out their breathing tube? The use of restraints is different at every hospital. Some are a little bit more pro restraints, some are less. And so I'm just kind of throwing this out there that restraints may be an option for your patient if they're high risk for pulling their breathing tube out, or using things like mitts. Right when we intubate someone, it can take a little while to figure out that sweet spot of sedation for them to where they're like sleepy enough to where they're not going to pull out their breathing tube, but not like too sleepy. So we really need to keep a close eye on our patients during this time. Two other things to consider are, one, how are they going to pee? Do you need to put a urinary catheter in them, or a PureWick, or something to help make sure that they're voiding, but we can also keep track of their I's and O's? And then feeding tubes. Depending on how long your patient's going to be intubated for, sometimes a provider may want you to put in a feeding tube right away, and sometimes they may want to wait a day or two, but that's always a good question I ask providers, are like, hey, do you want a catheter? Do you want a feeding tube? And that wraps up our post-management tips after your patient is intubated.